This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. Is there a COVID connection to strokes? Doctors in China and the U.S. say possibly. Here to tell us more, we welcome back Medical Director of Providence Stroke Center, Dr. Ted Lowenkopf. Good morning, Doctor. First of all,
good morning.
Is there a connection? Because you say that there are doctors in the U.S. and in China telling us that doctors in China seeing a connection between the two.
So there is a connection. It's early going, so we don't really understand the mechanism, but it appears that younger people who have COVID, a very small percentage of them, are at higher risk of forming blood clots. And those blood clots can travel to the brain, block an artery, and cause a stroke.
When you say younger people, what age are we talking about?
We're talking about people who are in their 20s, 30s, 40s, and don't necessarily have risk factors for having a stroke other than COVID.
Have we seen anything like that in the Portland area?
We have not. Again, it's early going. We don't know all the data, but in my own experience and my colleagues, we're not really seeing this phenomenon. And we think it's because we have much lower rates of infection than places like New Jersey and New York.
All right. And do you think, though, that there are people avoiding the doctor? I mean, are you worried? Are you concerned about people avoiding the doctor when they have stroke symptoms because they're worried about going into a hospital with, with possibly COVID patients?
Definitely. I looked at this very closely in our own hospitals and saw that from mid-March to mid-April, the number of patients coming to the emergency room with stroke symptoms went down by about 20%.
Oh, you're kidding me. What's in place to protect people when they come in the doors at Providence?
So I think we're doing a great job. There are designated areas where patients who have confirmed COVID or suspected COVID are hospitalized, both in the emergency room and in the hospital. And then there are separate areas where people are symptom-free and there's no suspicion of disease. And there's no evidence that by coming to the hospital, whether it's the emergency room or being admitted, that you have increased risk of getting COVID.
Why is it so important that people seek help if they have any stroke symptoms? I mean, time is of the essence, right?
Absolutely. Stroke is a medical emergency. When you're having a stroke, there's a blood vessel in your brain that's blocked off, and blood is not getting to your brain, and brain cells die within seconds. 2 million brain cells die for every minute that you're having a stroke. And most strokes are associated with significant disability. If you seek early treatment, you can reverse the effects of the stroke completely. So as soon as you recognize symptoms in yourself or someone else, call 911.
Well, let's talk about the symptoms then. What are they?
So we use a mnemonic that's called B FAST. B is for balance, sudden loss of balance, you're not coordinated. E is for eyes. Do you suddenly lose vision in one or both eyes or have blurred or double vision? F is for face, ask someone to smile. Does one side of the face stay down? A is for arms, ask someone to raise their arms, and if they hold them up, does one drift down? S is for speech. Is speech slurred, or is the person having trouble finding words consistently or not understanding speech? And if you see these symptoms in yourself or anyone else, call 911.
Okay, so let's say we see one of these symptoms in someone. Do we drive them to the hospital?
No, call 911. EMS is very well organized to take patients to hospitals where they can get urgent treatment, either a clot dissolving medication or a wire goes up into your brain and they pull the clot out. And if you take someone into the emergency room, it takes longer and the emergency room doesn't activate quite as immediately as when an ambulance rolls in with lights and sirens.
So if you say to someone on 911, I think let's say my husband is having a stroke, they'll get there, they'll know what to do, they'll be ready to go.
It's amazing how fast it is. From the symptom time at home, depending on the travel time to the hospital, we can get treatments within 30 to 60 minutes.
I'm curious, what can we all do to lower our risk of getting a stroke, of having a stroke?
So 80% of strokes are preventable. You never have to end up in the hospital if you know what the risk factors are and if you act accordingly with the help of your healthcare provider. So the number one risk factor for stroke and heart disease is high blood pressure. And even mildly elevated blood pressure dramatically increases the risk of stroke and heart attack. So that's probably number 1, 2, and 3. And then there are other risk factors. Do you have a condition called atrial fibrillation? If so, you may need to be on a blood thinner. Are you a smoker? Do you have high cholesterol in conjunction with other medical conditions? So there are a variety of modifiable risk factors. And if you work with your healthcare provider and address those things, you never have to have a stroke.
Yeah, those are all really important tips. By the way, that is a cute baby behind you.
That's my daughter when she was a baby. They're tired of seeing their dad on TV.
Thank you so much, Doctor. We really appreciate it. We're going to put all that information for everyone on our website at KATU.com. Dr. Ted Lowenkopf, thank you so much. Appreciate it.
Thank you for your time and spreading the message.
Absolutely. And we'll be right back with more AM Northwest. Don't go away.